Hello, I'm Dr. Brian Wallum, and this webinar is Integrating Nutraceuticals into Existing Protocols. And just so you know who's speaking, I'm the one on the right. A little bit about RX vitamins for pets. We've been around since 1998. Our Chief Medical Officer is Dr. Robert Silver, practicing veterinarian here in Boulder, Colorado. Our formulas are well-researched, condition-specific formulas. We've got a wide choice of treatment options to complement conventional care, and we are a member of the NASC. Now, to start, animals are multiple ecosystems, many different systems that need to be addressed in the animal, human and non-human. And the animal body is a self-healing, self-regulating organism. We just need to give it the right fuel in order to self-heal and self-regulate at its peak. Now, what's the first thing you think of when you look at this plant? And probably it's that it needs water. Now, perhaps you were gone on vacation for a week and you have a cat and the cat decided to pee in the plant for the entire week, which may be the problem. It got plenty of water, but the cat peed in the plant. Here's my point. There are only two reasons animals get sick. They're either toxic with something, the cat peed in the plant, and/or, typically it's both, they're deficient in something, the plant didn't get watered. Big picture is cell physiology will continue to adapt to physical, chemical, or emotional stresses put upon it, and appropriately it's called adaptive physiology, and really that's survival. The problem is when the cell becomes too toxic or too deficient for too long, it becomes weak and can no longer adapt. Now the cell is sick, the organ gets sick, and the animal gets sick if the cells can't self-repair. So these cumulative dynamic effects, toxins accumulate in the cells. Tissue can only dump a small amount at a time, but toxins keep being taken in. As they keep accumulating, this just snowballs out of control. Interesting quote here. Rudolf Virchow, the father of modern pathology, said, if I could live my life over again, I'd devote it to proving that germs seek their natural habitat, diseased tissue, rather than being the cause of the diseased tissue. We've got viruses, bacteria, yeast, mold, fungus in us. It's when the tissue gets weak that they take over. So ask yourself, when the pet comes in to the office, the hospital, what's the tissue in this animal in front of me? Why is the tissue diseased? And what's this animal toxic with and/or deficient in? Now, the why to integrating nutraceuticals. The job of a nutraceutical is to help remove toxins and to replace tissue deficiencies, which is different than a pharmaceutical. Its job is to help rebuild the tissue or organ. And why does, or where does the breakdown start? And it's the diet. My big three are gut, liver, and kidneys. If you can get those up and running, you've got a good shot at having a healthy pet. And food must be broken down. I don't care if you are given the pet the absolute best food possible. If it's not being broken down by the enzymes and getting into the cells, it's all in vain. And digestive enzymes need for the small intestine to be alkaline. Undigested food will irritate the bowel. Bowel irritation is going to lead to leaky gut, and leaky gut, or intestinal permeability, is going to lead to an exhausted immune system, because immune system is going to be chasing food particles instead of bacteria, yeast, molds, fungus, etc. And processed and/or undigested foods produce increased cell acids. Now here's the problem with cell acids. An overload of acid will decrease potassium and chloride, so then there's less chloride for HCl. And CCK is secreted in response to HCl, and bile is secreted in response to CCK, cholecystokinin. So you get a decreased bile release and you get a decreased fat emulsion. So the chain is inappropriate diet will change the pH, which will impair enzyme function, lead to irritable bowel, leaky gut, dysbiosis, an overworked immune system, and then you can just start putting your list of problems there. So how do we restore the intestinal ecosystem? Change the diet if at all possible, and I understand that can be very difficult at times. Digestive enzymes, nutrition to heal the bowel wall inflammation, and probiotic. So RX has a RXzyme formula. It's 7 enzymes with some prebiotics. It's designed to improve gut or GI ecology. It's in a powder form. You just sprinkle a little bit on the food each time you feed your pet, and it really promotes overall digestive function and breakdown and absorption of the food. Our biotic, it's got 4 probiotic strains, a couple of prebiotic strains. This helps normalize GI function. We all know the benefits of probiotics. Nutrigest is the bowel healer. It's got glutamine, ginger, aloe, garlic, handful of other things, and it really helps restore that mucosal epithelial cell function. And really, in my opinion, probably all the pets that come in your door have some form of leaky gut. Our RX clay, hydrated calcium aluminosilicate clay, it's a powder, and it's an adsorbent, AD. It traps bacteria and it doesn't dehydrate the bowel. So it's very helpful with enterotoxins, endotoxins, aflatoxicosis, and it helps to improve stool quality. The liver. The liver does many things. Absorbs nutrients and toxins from the small intestine, neutralizes toxins, balances hormones, balances blood sugar even more so than the pancreas, turns ammonia into urea, very important, helps to regulate cholesterol. So a healthy liver is extremely important. How do you restore the liver ecosystem? Well, reduce toxic intake if at all possible, flush out the liver tissue, and give the liver some hepatoprotective nutrition. Enter our hepato formula, our liquid hepato. Both our hepato formulas are milk thistle based. It has a complement of B vitamins. They both have alpha lipoic acid. The liquid form uses lecithin in there, and this is very hepatoprotective, and you use it for any compromised liver. It helps increase glutathione production, protects the liver from toxic damage, and you can use this prophylactically. You don't necessarily have to wait for liver enzymes to be askew. You can have a patient take this occasionally every few months, go through a week of it, and just rinse out the liver a bit, not just wait till a blood test comes up with enzymes that are off the charts. And here's our capsule formula. All our capsules are 2-piece hard shell capsules, easy to pull apart and mix in with the food if it's too difficult to pill the pet. Again, milk thistle base. Our powder form, or in the capsules is a powder, uses D-L-methionine, inositol, and choline. And again, any liver problems, and it can be used prophylactically. Now, formula HL with the carnitine, taurine, and vitamin E, it's a water-soluble powder, and it's designed for tube feeding, and it helps to reduce lipid peroxidation in cats. Now, the overworked and underpaid kidneys. They're a set of filters, and at any given moment they're pumping about 20% of the blood, and they work 24/7, 365. Very intricate in blood homeostatic maintenance and restoring the kidney ecosystem. You want to flush them out if possible, heal the tissue, increase the blood flow to the kidneys, decrease the toxic intake. So we have a formula, or RX renal canine and feline, which has astragalus and acetylcysteine, rhubarb, milk thistle, asparagus, donquai, etc. And this is for addressing elevated renal values. Our phosbind, it will complex with dietary phosphorus in the bowel to help support normal kidney function. And it's an aluminum hydroxide powder, excellent formula. Then we have our amino B plus K when you need a palatable source of dietary potassium. It's got 468 milligrams of potassium, plus it's in an amino blend with B vitamins, spirulina, some elemental iron. Now, why is it so important to support the liver and kidneys on a continual basis? Because they never stop working. They never have a rest. Our general nutrition formulas, and I'm going to stay on this slide for a bit, and let's go to the far left, the amino B-plex. When you need a B vitamin in an amino acid form by itself, that's a liquid, and it enhances the vitality for those in need of metabolic support. Directly to the right there, the canine and feline minerals are a powder, and they provide micro and macro mineral supplementation. Let's go over to the far right, the RX Essentials. They're a broad-based nutritional support in a powder form. They've got your Bs and your minerals, plus some spirulina, kelp, and milk thistle in there. And then dead center, the nutritional support, it's a powder, and it provides a nutrient-dense base of phytonutrients, antioxidants, and food-bound nutrients in a liver salmon powder with some lecithin in their base. An excellent formula. So we've got broad spectrum nutrition for you. Our immune formulas, we've got the liquid immuno and immune support in the capsules. These are for acute and chronic immune challenges. These enhance properties to improve immune system function. It's got the liquid has a reishi mushroom, the capsules have the shiitake mushroom. They both have lutein, they both have arabinogalactans, and there's L-lysine in the liquid immune formula. Our OncoSupport, again a powder, it supports increased metabolic needs of patients with chronic disease. And it's got a host of ingredients. Some are on the screen here: nutritional yeast, glutamine, delamune 5, arabinogalactan, etc. So for a compromised immune system, an excellent formula. Mix it in with the food. Our glucomune formula, is a high-potency beta-glucan, and this can help to increase macrophage phagocytosis. Now, here's a clinical consideration. The immune system is tied to the digestive system, and consider supporting digestion with enzymes in chronic or recurrent immune situations, and this particularly includes skin allergies. It's my opinion, and I said this before, that probably every companion animal that comes to your clinic has some degree of intestinal permeability. Now, we've got a great marine lipid concentrate for an EFA formula. 1 teaspoon contains 3,000 milligrams of omega-3s in our EFAs. Our joint formulas, are designed to improve joint function and health. We've got a Nutraflex, which has some natural anti-inflammatories in it, and our Megaflex, which is MSM, chondroitin, glucosamine, and some vitamin C. Our NutriCalm formulas, these help to soothe and relax naturally. Theanine, tryptophan, valerian catnip, calcium, magnesium, ashwagandha. It's designed to calm and soothe without sedating. You don't need to ramp up with these. You can give it on an as-needed basis, 45 minutes to an hour before maybe going to the vet or taking the pet in the car. Calms them right down. Our cranberry formula, this is nutrition for the urinary tract in a capsule form, a very tiny cap. It also can be opened up and mixed on the food. Our cardiovascular formulas and the CoQ10 we always put in there too. It's a hawthorn berry based, carnitine, taurine, potassium, magnesium, and this is for cardiovascular support. And we have the CoQ10 because it's so important in helping heart function. And we have vitamin C, of course, cats and dogs make their own, and liquid vitamin A, which has got 2,000 units of A per drop, so it's a very potent vitamin A. RX vitamins for pets are sold exclusively to veterinarians. Integrate the RX formulas with your existing protocols safely and effectively. And these formulas are designed to remove toxins and support tissue deficiencies. An integrative practitioner is looking to help rebalance all the ecosystems of the body. And remember, there's only two reasons animals get sick. They are toxic with something or they're deficient in something from something. And always, when diagnosing, consider what's happening in the gut. Almost all disease processes start with a dysfunctioning gut. If you have any questions, please call me on my cell. I'm Dr. Brian Wallum with RX Vitamins for Pets.